Good morning. It's 8 o'clock Monday morning. It's the start of my working week. I'm Debbie Dewhurst and I'm one of a team of 4 of social prescribing link workers based within the Rossendale Valley. Together we cover the whole 9 GP surgeries within the primary care network in Rossendale. And this morning I'm working from Waterfoot Health Centre. This morning I have 2 initial assessments with patients that have been referred by the GPs here at Waterfoot. Within these initial assessments, we can give an hour's time where we discuss and we listen to what the patient has to say. We can put an action plan together with what matters to you as a patient on how we can take this referral forward. Hi, so I've just arrived at a lady's house. I'm going to do a home visit this afternoon. We should have been going for a walk, but it's a little bit wet, a little bit windy, and the lady feels a little bit unsteady on her feet. So just for this afternoon, we're going to do a home visit. I'm working with this lady since for about 2 months now. Unfortunately, about 8 months ago, she lost her husband and she's lost all confidence in going out and doing anything by herself. She would have spent a lifetime of doing these things with her husband. So together we're going to work on that. We're going to work on building her confidence, get her out there, hopefully get her going to a group or an activity that she'll enjoy and make friends again. The social prescribing team have an office here in the ABD Centre in Bacup. And this morning I'm here to meet a gentleman who was referred from the occupational therapy to help him fill an application for housing. This gentleman has no IT skills and is struggling with what to do and where to go.
Hello, I've come to the ABD club today and Debbie's been very helpful and sorted me out with the bidding to try and get a house for myself, bungalow or something, and it's been very good.
Once a month, the whole social prescribing team across Burnley, Pendle and Rossendale get together for a team meeting. Within these meetings, we're able to utilise each other's skills and learn from one another.
She said she wouldn't be here today. She sent her apologies.
Thanks across your team. But as I say, Beacon Counselling Trust, we are a mental health service provider.
Part of the role of social prescribing is to help people access their local community. Once a month, this afternoon, the wider social prescribing team across Burnley, Pendle and Rossendale get together for a team meeting. At Knits and Fritz. Within these meetings, we're able to utilise each other's skills and learn from one another. Continual development and training is a vital part of our social prescribing role.
Since a conversation I had with my doctor about my depression, they referred me to Debbie, and since I've been with Debbie, we have been going out into the community and doing things, going for groups, walk arounds, having lunch, and since I've been seeing Debbie, I have grown more in, become more me and come out of my shell.
This morning I'm meeting a young man for the first time. He was referred to the social prescribing team by his GP for anxiety and depression. And although we're going to do the initial assessment, we're taking advantage of the beautiful weather we've got here today in Rossendale, and we're going to do it as a walk and talk around the local park. As social prescribing link workers, we not only work with individuals, we work with groups as well. And this morning, Zainab has popped in just to say hello, introduce herself and see how we can work in the future.
Good morning, my name is Zainab. I represent Chai Rossendale. It's mainly based in Haslingden at the other end of the valley at the moment, but I've popped into the CVS this morning to see how we can work together for future.
Let me introduce you to my colleague Carol.
Hi, I'm Carol Williams, a part-time social prescriber based at the AB&D Centre in Bacup. This is where a lot of the work's done as well behind the scenes, where we have training, where we do research, where we connect with other agencies, and we also now have a consulting room which is next to our office, so we can invite clients down face to face to come and chat with us as well. It can be very good that they come down here because it can be part of making them a little bit more confident. I mean, obviously, if they can't, we will go to them, but we've got big hopes for our consulting room, so let's hope that we see a steady stream of people coming through the door.
Hi, I'm Simon, one of the part-time social prescribers with Rossendale.
Hi, I'm Carol Williams. I'm a part-time social prescriber in Rossendale.
Hi, I'm Shahan Lace, full-time social prescriber in Rossendale. Wonderful weather. Rossendale weather.
Yeah. So I'm here at the Whittaker in Rossendale for the Rossendale Connected Health and Wellbeing Partnership meeting. Rossendale Connected started 2 years ago in March 2020 in preparation for the pandemic to support the people in the community in Rossendale for those that were shielding and isolated. And 2 years on, it's still going strong. The social prescribers in Rossendale are still a vital part of the Rossendale Connected, supporting the community, and it's a group to support the community with members of the community. And today it's the first meeting face to face since it started, so I'm looking forward to meeting a lot of my colleagues from the multidisciplinary team that I haven't seen in possibly 2 years face to face. So hopefully Zoom is a thing of the past and we're moving forward.
Hiya, my name's Colin. I've been seeing Debbie for quite a few months now, and she's helped me a great deal over the past 6 to 12 months or so to help me get back on my feet, which I'm doing slowly. I'm getting out a bit more. She's helped me other things as well, financial matters, health matters, and she's a wonderful person and a great social prescriber. It'll be sad when it ends soon, but that's the way things go, I suppose. But other than that, without Debbie's help, I don't think I'd be around to this day. I've been bad in the past. I feel, like I say, better now. It's all down to Debbie, and I can't thank her more than I can do from the bottom of my heart. I think she's a brilliant lady.
I'm working from Fairmore Medical Practice today, and I'm on my way to see a gentleman that was referred through to the social prescribers from Dr. Colleen. I've been working with this gentleman for about 12 months on and off. Initially, he was referred through because of financial issues. Secondly, for support with his anxiety and depression. And thirdly, for us to link him in with the community, to help him find a group that he felt part of and where he was able to make friends and feel comfortable. Today I'm going to go and we're going to review his care plan, as once again his support is coming to an end. He has been a prime example of what social prescribing is all about. I've been able to link him in with services, I've been able to refer him on to other agencies, and I've been able to do some one-to-one work with him myself. Hi, it's Friday afternoon at 4 o'clock and I'm finishing my working week here in Whitworth. I'm hoping by watching this video that you've had a glimpse into the working week of a social prescriber. So just to recap, I've worked from 4 different surgeries where I've met patients face to face. I've spoke to them over the phone, via text or email. I've gone out into the community and done a further 7 face-to-face visits. I've had 2 multidisciplinary team meetings, as well as meeting with my own team and the wider social prescribing team within CVS, Burnley, Pendle and Rossendale. A lot of hours are done within the office where all the necessary paperwork, reports and client updates are maintained. Please don't hesitate to get in contact with either one of us within the Rossendale, your GP or any other healthcare professional. And you can also do a self-referral.